Hello, this is the Auditory Learner. We are going to be doing a study guide for the nutrition section for the National Board for the Dental Hygiene exam. So let's get right into it. We're going to start with the nutrients. And what we need to know is that there are a total of 6 nutrients, which we're going to be talking about throughout. These nutrients are carbohydrates, proteins, lipids, vitamins, minerals, and water. So that's carbohydrates, proteins, lipids, vitamins, minerals, and waters. So let's begin with the carbohydrates. So what we need to understand about carbohydrates is that there's 3 different types of carbohydrates, okay? And they all yield about 4 kilocalories per gram, and they provide a source of energy, okay? So the carbohydrates that we need to know are the monosaccharides, the disaccharides, and the polysaccharides. So for the monosaccharides, which is one of the most important ones because it provides direct energy for your brain and into your blood, those are going to be glucose, fructose, and galactose. And the way that we're going to remember these are by the mnemonic good for Gary. So GFG is good for Gary. So when you think of mono, it's glucose, fructose, galactose. That's good for Gary. Next, we're going to understand disaccharides. Disaccharides are sweet like me. That's the mnemonic we're going to use for that. And that's going to be for sucrose, lactose, and maltose. Okay, that's disaccharides. Then we're going to get into the polysaccharides. We're going to use a mnemonic called good for Steve, which is glycogen, fibers, and starch, GFS. Okay, and out of all these, one of the most important things that we have to know is the disaccharides. We need to know what the makeup is for the disaccharides. So these disaccharides contain at least 2 molecules of monosaccharides. And then we have some mnemonics for this too. So the disaccharides, which is sweet like me, which is sucrose, lactose, and maltose, we're going to start with sucrose. So which monosaccharides make up sucrose? We're going to think go floss. That's going to be glucose and fructose, GF, go floss, glucose and fructose. Then the next disaccharide, lactose, we're going to think about go Gary. That's going to be glucose and galactose, GG. All right. And then the third disaccharide is going to be maltose. This one, we're going to go with go glucose, and it's going to be 2 glucose molecules. So very similar to go Gary, but this is go glucose, and it's going to be, just think about G squared because it's 2 of the same. All right. So sucrose, go floss, glucose fructose, lactose, go Gary, glucose galactose. Maltose is go glucose, 2 molecules of glucose, G squared. Some key points here that we need to understand about these carbohydrates are that glycogen is made in the liver, and it provides energy to your muscles. Also, fiber, which is a polysaccharide, it assists in peristalsis. Okay. And again, the carbohydrates provide an energy of 4 kilocalories per gram. And understand also that there are 6 nutrients, which are carbohydrates, protein, lipids, vitamins, minerals, and water, which we are going to go in that order. All right. And the other thing that we need to understand here, another name for glucose is dextrose or blood sugar. And understand that glucose is the main fuel for the brain. Okay. And it's also needed for white blood cells and red blood cells. It's the most abundant carbohydrate in nature. Okay. Fructose, another name for fructose is called levulose. All right. That's a fruit sugar. And when you think of lactose, of course, you're going to think about milk sugars. Okay. These are just some side things here, not as important as what we talked about there, but when you think about the disaccharides, which is sweet like me, right? Sucrose is table sugar. All right. Um, and then lactose is milk sugar, and then maltose is plant sugar, sweet like me. So table, milk, plant. Could have created something like that, but here, okay, here we go. Okay, so then also the polysaccharides are the most complex one. Um, and that one's usually in plant storage form for glucose, which is a starch. So polysaccharides are also, like I said, it's good for Steve, glycogen, fibers, and starch. All right. So another thing we need to understand is the digestion of starches. Starch digestion, it initially begins in the mouth, okay, with the enzymes in the salivary glands that produce amylase, and then they continue into the small intestine. Um, and then the monosaccharides, which are the most important carbs, those enter the capillaries, and glucose goes directly into blood. Okay. So we also know that carbohydrates aid in oxidation and burning of fats to prevent ketosis. All right. So let's get into now the alternative sweeteners. So for alternative sweeteners, this is how we're going to remember this. There's three types of nutritive sweeteners. All right. And then there's five types of non-nutritive sweeteners. Okay. So whenever you think of alternative sweeteners, there's two subsets. There's nutritive and non-nutritive. All right. So there's three types of non-nutritive sweeteners, which are sugar alcohols. So the OLs, right? And here we're going to think about so many xylitols, SMX, because the three non-nutritive sweeteners are sorbitol, mannitol, and xylitol. Okay. These are carbohydrate-like. These are sugar-like. They do have calories. All right. And for xylitol, Streptococcus mutans love xylitol, but they don't metabolize it. So that's why Streptococcus mutans ends up dying since it can't metabolize it, which is the benefit in consuming xylitol. Okay. And that those are the three nutritive sweeteners. All right. So many xylitols. Sorbitol, mannitol, xylitol. All right. And xylitol is the antimicrobial one that Streptococcus mutans cannot metabolize, which we can find in gums and candies and lozenges. Now we're going to talk about the five types of non-nutritive sweeteners. Here, the mnemonic we're going to use for this is called NASA's. So like NASA with an S. So it's not as sweet as sugar, NASA's. And it goes in this order. We're going to start with neotame, which was FDA approved in 2002. The next one is aspartame, which we understand that has the PKU warning, the phenylalanine warning there for people who cannot metabolize phenylalanine, which is an essential amino acid. But we'll talk about that later on. So that's aspartame. The S is saccharin, which is also called sweet and low. And the A is asulfame K, which is sweet one. And then the last S is sucralose, which is Splenda. So NASA's, like there's two NASA's, right? Not as sweet as sugar. Neotame, aspartame, saccharin, asulfame K, and sucralose. All right, so these are non-nutritive sweeteners. There's five of them because, for one, they are non-caloric. They don't contain calories. They are a non-carbohydrate, and these have to be FDA approved. So all of these were FDA approved at some point. But the one that we know that got FDA approved in 2002 was the N, neotame. Okay, and then we're going to move forward into the nutritional management of deficiencies. And here we're going to talk about diabetes, very important. So there's type 1 and type 2 diabetes. So a normal glucose levels are 70 to 120 milligrams per deciliter. All right. Then we have type 1 and type 2. Type 1 is usually the minority of cases that usually occurs in children and young adults. This one is when they are insulin dependent. Okay. And the origin is could be autoimmune. Some say that it's viral. Some say it's environmental. Some say it's genetics. Um, but we do know that that comes from mainly we've been hearing autoimmune. So type 1 could be viral, environmental, or autoimmune. And type 1, again, is insulin dependent. They need insulin. Their body does not make insulin. In the islets of Langerhans in the pancreas, it cannot synthesize it. And type 1 diabetics usually have an increase in appetite with weight loss. Okay? Weight loss. Type 2, on the other hand, they have an increase in appetite with weight gain. So, type 2, which is the most common, usually in adults over 40, and that one it develops, which is associated with obesity and metabolic syndrome. And it's just results from an insufficient and improper insulin function. Okay. Um, we'll talk about the drugs to treat this in pharmacology, but we're just going to get into also how to differentiate between hyperglycemia and hypoglycemia, which is going to be one of the important signs and symptoms that we're going to need to remember for the national board. The hyperglycemia sign and symptoms are an acetone or a fruity odor or breath. Okay, so hyper, too much high glucose in the blood. And people with who are experiencing hyperglycemia, they're going to have an acetone fruity odor or breath, and they are going to be experiencing what's called polydipsia, polyuria, polyphagia, which is increase in thirst, increase in urination, or an increase in appetite. Okay. Now, very important, hypoglycemia. That is the signs and symptoms we need to understand as well. Hypoglycemia, you almost want to think like if it's a sympathetic reaction, sympathomimetic reaction, because when people are hypoglycemic, they do get palpitations, they get shaky, they get dizzy, they get irritable, they get headaches. All right. They do not have a lowered heart rate. So the palpitations obviously means that they are having higher heart rate. So that's the reason why when you think of hypoglycemia, you almost want to think of like a flight or fight response. Okay. And so for diabetics, we want to schedule them early in the day following breakfast because we need to have them have absorbed the sugar. Okay. And it's good for them to reduce their stress. Okay. Um, Again, we know that people with diabetes have 3 times more likely to develop perio disease, increased infections, oral candida, xerostomia, retinopathy, neuropathy, amputation, poor circulation. So these types of patients will be having a higher increase in all these symptoms and signs that we just mentioned. But very important to understand the difference between hyperglycemia and hypoglycemia. Okay. Um, the next thing that we're going to talk about is about diet counseling. So, real quick, very simple. Uh, we should be motivating the patient to make better decisions when it comes to choosing the food that they decide to eat and allowing them to choose what should be eliminated from their diet. Uh, Overall, for diet counseling, we just need to make sure that um, when we do a survey, that it's all about the frequency of intake. That's the most important thing to understand. Also, the how frequently are they eating fermentable carbohydrates? So that's going to be important. All right. From here, we're going to go on to proteins. All right. So now for proteins, all right, these include amino acids. So when you think about proteins, you want to think about amino acids. What do amino acids do? What do proteins do? They help in building and repairing the cells and tissues of the body. They also contribute 4 kilocalories per gram. The digestion of proteins, of amino acids, starts in the stomach. Let's talk about the essentials and non-essential amino acids, the proteins. So there's 9 essential amino acids. They must be obtained from diet. These are the complete high quality proteins, which is meat, eggs, fish, cheese, and milk. All right. So these contain all 9 essential amino acids. Okay. We need to understand that there are also non-essential amino acids. So there's 9 essential, there's 11 non-essential, and these can be synthesized in the liver, but they're also derived from the diet. Okay. So we're gonna also touch on incomplete low quality proteins. That means that they lack one or more essential amino acid, like a plant protein. Also, complementary proteins, you need to combine 2 or more proteins to compensate indeficiencies. But again, most importantly, understand there's 9 essential, which must come from diet, and 11 non-essential ones that can be synthesized in the liver. We're going to talk about now PKU, which is phenylketonuria. Phenylketonuria. So here, this is defined as a genetic metabolism disorder or error where the body does not metabolize phenylalanine, which is a amino acid, and it doesn't um, convert it into tyrosine. So these types of patients who have phenylketonuria, they must avoid aspartame or aspartame, as I've heard it before, or NutraSweet or Equal. Those are aspartame or aspartame. So PKU, avoid NutraSweet or Equal. Um, the next thing we need to know about is the protein energy malnutrition symptoms or forms. There's 2 main ones. So these two are marasmus and kwashiorkor. All right. How we're going to distinguish between marasmus and kwashiorkor is that for marasmus, there is no edema. And this happens in the youngest of children, literally 6 months to 18 months old. Okay. This happens in impoverished nations. And these types of patients or people that we may see, they look like skin and bones, okay? Or like if they have wasted away, they are not getting enough protein, not getting enough calories, not getting enough nutrition, very poor growth. So everything is weakened. But so marasmus, no edema. Marasmus, no edema, youngest, 6 to 18 months. Kwashiorkor is there is edema in the legs, in the abs, in the face. This happens from 18 months to 2 years old. They also experience delayed tooth eruption and hyperplasia. and they also fail to grow and they gain weight, and usually in the legs, abs, or face. So marasmus, skin and bones, no edema, 6 to 18 months. Kwashiorkor is going to be edema in the legs, abs, or face, 18 months to 2 years old, and delayed tooth eruption with hypoplasia. Okay, we're going to go into the fats section, which is the lipids. Now, lipids provide a little bit more calories per gram. This is 9 kilocalories per gram. So for fats, we need to understand that there are three different types of fats. There's saturated fats, monounsaturated fats, and polyunsaturated fats. So the saturated fats are bad. The monosaturated fats are okay. The polyunsaturated fats are good, and we're going to explain why. So polyunsaturated saturated fats that are bad, those increase the serum cholesterol levels. Those are solid at room temperature, and those come from beef, lard, and animals. All right. So saturated fats, not good. Okay. They increase serum cholesterol levels. They carry the maximum number of hydrogen atoms, hydrogenation. We're going to go into monounsaturated. These are okay because these maintain serum cholesterol levels. It is viscous and it seems to derive from oils such as canola or olive oils. Okay. And then we're going to talk about polyunsaturated fats. These are the good ones. These decrease serum cholesterol levels. Okay. And they are essential fatty acids. So the polyunsaturated fatty acids, there are essential polyunsaturated fatty acids, which are omega-6 and omega-3s. So omega-6 is linoleic fatty acids. So 6-linoleic, and these come from vegetable oils, such as safflower and sunflower. Then there's the omega-3s, which are linolenic, and these come from fish and also certain plant oils, which could be like olive and peanut and canola. So for the national boards, understand that omega-6 leic 3 lenic. 6 leic 3 lenic. 6 leic 3 lenic. 6 vegetable oils, 3 fish and plant oils. Those are the essential fatty acids, which are only polyunsaturated. Okay. The next thing is that we need to know is that these lipids, they carry the fat soluble vitamins such as ADEK or ADEK. All right. And the lipids provide satiety, which is feeling of fullness. They also insulate the organs. And they also provide flavor and texture for certain foods. So this then leads us to talk about vitamins. Okay, so here we're going to talk about the fat-soluble vitamins. They're stored in the liver and in the tissues. So we're going to go ADEK, A-D-E-K. We're going to start with fat-soluble vitamin A. Vitamin A is retinols and carotenoids. Okay, so retinols come from animal foods and liver or fortified milk. Carotenoids come from orange to yellow and dark green vegetables or fruits. Some of the deficiencies that might happen from vitamin A are night blindness, all right, or stunted bone growth. Okay, stunting of bones. That's a deficiency of vitamin A. One thing also that we need to make sure we understand is vitamin D, which is calciferol. All right, this helps. So vitamin D helps absorb calcium and phosphorus, and it provides bone health. The main source of vitamin D is through exposure to sunlight. That's 90%. All right. Also, some of it comes from food, including milk, but human milk is very low in vitamin D. Also, vitamin D can come from fatty fish, such as salmon, tuna, or sardines, or cod liver oil, as I've been hearing. So whenever you have a deficiency in vitamin D, this is not good. People can get rickets or osteomalacia, osteoporosis, and sometimes even colon cancer. So, what is rickets? Rickets happens in children when the bones become soft due to failure of calcifying normally. And so they have bowed legs, enlarged heads, joints, and rib cages, and they might have a deformed pelvis. Osteomalacia happens in adults, which is when calcium is taken from the bones to make up for insufficient absorption in the intestine. Symptoms for osteomalacia is also bowed legs, but more so of a bent posture and the pain in the ribs and pelvis and the legs. The next fat soluble vitamin we're going to talk about is vitamin E, which is tocopherol. This is an antioxidant and also stimulates immune response, and this comes from vegetable oils, corn, safflower oils, and green leafy vegetables. But too much of vitamin E can interfere with blood coagulation and the function of vitamin K. So it can also cause gingival bleeding, especially if the patient is taking aspirin. So too much vitamin E is not good. The last vitamin, fat soluble vitamin, is vitamin K. This aids in forming blood clotting factor prothrombin in bone health. The sources for vitamin K are green leafy vegetables, canola, and soybean oils. So again, the functions for vitamin K is blood coagulation, bone health. The function for vitamin E are antioxidants and immune response. The function for D is bone health, and calcium and phosphorus intake. And for A is vision, bone health, and immune system. And again, deficiencies for A, night blindness. Deficiencies for D, rickets and osteomalacia. Deficiencies for E are rare. And deficiencies for K are hemorrhaging because of the blood coagulation. Okay. Um, One thing to understand about vitamin E is that it's easily destroyed by heat and exposure to air. So overconsumption interferes with blood coagulation. All right, so now let's get into the water-soluble vitamins, which include all the V vitamins and the C vitamins. We already know about vitamin C. We know that that's ascorbic acid. We know that that prevents scurvy, and we know that it's an antioxidant, very important for collagen and tissue regrowth and health. But let's get into the vitamin Bs. So B1, B2, B3, um, B12. All right. So that's what it is right there. B1, B2, B3, B9, and B12. Okay. The only ones that don't have a B in it or classified as a vitamin B is biotin, pantho, panto, pantothenic acid. Those are the only two that don't have a B in a number. But let's get into that now. So vitamin B1 is thiamine. All right. Vitamin B1 is thiamine. It's an enzyme needed for nerve and metabolism function. Deficiency for thiamine is beriberi, which damages the nervous system and the cardiovascular system. Thiamine comes from pork, whole grains, and enriched fortified foods. So B1, you want to think of thiamine. Thiamine, B1. B1, you want to think of beriberi. All right. And again, the sources are from pork, whole grains, and enriched fortified foods. Vitamin B2, that's riboflavin. Riboflavin is vitamin B2. This is another enzyme used in energy metabolism. The nutritional deficiencies for B2, riboflavin, are chelosis and glossitis, or also called erybroflavinosis. Okay, so riboflavin, chelosis, glossitis. B2, chelosis glossitis. You get vitamin B2 from milk, grains, and whole grains. However, these things are sensitive to light. All right. The next one is B3, which is niacin. Okay, this is another enzyme used in energy metabolism. Niacin deficiency is pellagra. All right, pellagra, you get dementia, diarrhea, dermatitis. It's the 4Ds. It's painful in the skin. It also can cause death. Sources for niacin are meats, fish, grains, cereals, and sweet potatoes. So niacin is the amino acid tryptophan. It has the amino acid tryptophan can be converted to niacin equivalents. So niacin B3. Next, folate, folic acid. Folate is vitamin B9. Okay. Folate is vitamin B9, also called folacin or folic acid. This is important for DNA and RNA and red blood cells. Um, when you have deficiencies in folate, you can get megaloblastic anemia. You can also get glossitis. You can get diarrhea, but also you can get spina bifida if you're going to have children. It's basically a birth defect. So folate, spina bifida, and megaloblastic anemia. And where do we get folate from? Dark leafy greens, enriched rice and breads and pastas, and also some citrus fruits. Okay, cobalamin, which is cyanocobalamin also, but that's the B12. So B12 is cyanocobalamin or just cobalamin. This is essential for red blood cell development and needed for folate metabolism. So you need B12 for folate metabolism, which is B9. Um, so B12, again, it's found in strict vegetarians, but the deficiency is in found pernicious anemia, causing weakness, sore tongue, and apathy. Sources of cobalamin or B12 have to come from animal products. So vegans can get sources from sea vegetables or from fortified soy milk. But again, cobalamin comes from animal products. Properties are intrinsic and extrinsic factor. I remember that being a question. So which B vitamin has intrinsic and extrinsic factor? That's going to be vitamin B12, cobalamin. All right. So what does that mean? Intrinsic factor means that the protein made in stomach needed for absorption of B12. Extrinsic factor means it must be obtained from diet. And then the last one is vitamin C. As we know, ascorbic acid promotes synthesis of protein collagen, connective tissue. It's an antioxidant. Nutritional deficiencies are scurvy, ruptured blood vessels, swollen gums, poor wound healing. We get vitamin C from strawberries, broccoli, cantaloupe, citrus fruit, oranges, and apparently tomatoes and potatoes. No extensive storage. Smokers need this a lot. Smokers have an increased need for vitamin C. So let's kind of run it back real quick with the water soluble vitamins. That's B1, B2, B3, B9, and B12. Also, pantothenic acid, biotin, which is part of the water soluble vitamins. B1 is thiamine, B2 is riboflavin, B3 is not niacin, B9 is folate, B12 is cobalamin, and vitamin C is ascorbic acid. So when you think of thiamine, you want to think of beriberi, right? And again, what is beriberi? Beriberi is damage to the nervous and cardiovascular system. Okay. And where do you get thiamine from? From pork, enriched and fortified foods, and whole grains. Riboflavin, you want to think of chelosis glossitis. Riboflavin B2, chelosis can cause chelosis and glossitis. Comes from milk, grains, and fortified foods. Okay. B3 is niacin. You want to think of pellagra with niacin. And what is pellagra? It is the four Ds: dementia, diarrhea, dermatitis, and death. Okay, so those are the two that actual deficiencies there. Pantothenic acid, we'll touch on that. There's rare deficiencies for pantothenic acid, and it's present in many foods. Biotin, another, it's rare to have a deficiency in biotin because it is present in many foods. Uh, but when you have a deficiency in folate, you want to think of, which is B9, again, spina bifida and megaloblastic anemia. When you have cobalamin, B12 deficiency, which is also cyanocobalamin, you can have pernicious anemia or a sore tongue, usually found in vegans. So let's remember this stuff here. There's two different types of anemia deficiencies. There's megaloblastic, that's folate. And then there's pernicious, that's cobalamin. Okay. And we know about vitamin C. Let's get into the minerals now. So the minerals that we need, they're called macro minerals. And we need to have these present in amounts greater than 5 grams in the body. So calcium is the most abundant mineral in the body. All cells need calcium. The functions are forms and maintains bones and teeth and blood clotting. Um, so again, calcium deficiency, just like vitamin D, is going to be rickets, osteomalacia, and osteoporosis. Um, so again, we need vitamin D to help absorb calcium. The next thing here is we're going to talk about sodium. Sodium contributes to high blood pressure, which can lead to heart disease and stroke and hypertension. Hypertension is not caused by excess sodium, but it does aggravate it. If there's recommendations, you need to reduce sodium intake and increase cooking with spices. Sources 90% consumed is in table salt form. Okay. So make sure we know that calcium is the most abundant mineral in the body. All cells need it. And if you don't have enough, you can get rickets, which is bowed legs in children, and weak pelvis. Osteomalacia is the same thing in adults, but they have more of a bent back. And then we have sodium. Sodium contributes to the high blood pressure there, but it's also important for the brain as well, and a lot of other action potentials for our nervous system. We'll talk about more of that later. Let's get into weight control and eating disorders, which is going to be part of our conclusion here. So, when we hear the term BMR, that stands for basal metabolic rate, which is basically measuring the energy needs to maintain life at rest. And all this is affected by how much physical activity you have, um, and the thermic effect of food, energy required to digest and absorb food. All right, so let's talk about anorexia. Anorexia is starvation due to a distorted body image, usually occurs in females after puberty between the ages of 15 and 19. And it's basically the fear of gaining weight. So every time someone is diagnosed with anorexia, it is a self-starvation that's happening there. There is dramatic weight loss, 20 to 40% below desirable body. Then they also excessively exercise. They have an aversion to food. And they may also have what's called amenorrhea, which is an absence of the menstrual cycle caused by hormonal changes. There is something called hirsutism, which is lanugo, which is fine, soft hair, um, decreased heart rate caused by metabolic slowing. So the way you treat anorexia, which is self-starvation, is that they need to increase food intake, and they also might need to see a therapist. All right. So now bulimia is completely different. This is a binging and purging disorder. So vomiting. They may use laxatives. They may use enemas or purgatives, diuretics, to prevent weight gain. So this is not starvation. They are literally eating and then they're throwing it up. This happens between the ages of 20 to 24. Weight is at or slightly above normal. Okay. Turns toward food for comfort. And they are aware that behavior is abnormal. They have very low self-esteem as well. Also very impulsive. So binge eaters, they binge or vomit at least 2 times per week. They might eat 15,000 calories or more during a binge. They also get calluses forming on the knuckles from digital purging. So you can see it on their finger, which is a characteristic that is a manifestation there. Oral manifestation is basically perimyelitis, which is dental erosion on the lingual surfaces from all the acidity of throwing up. Constant exposure to acid. Restorative erosion, so restorations may appear raised from the teeth. Um, there's also tooth sensitivity. They may also have enlarged parotid glands that might occur unilaterally or bilaterally from gorging food and purging. Chelosis is also associated because of a loss of moisture and protective qualities of saliva. Pharyngeal tears and erythema of the palate. The pharynx and posterior tongue can result from objects or fingers used to induce vomiting or regurgitation. So, when we're doing a differential diagnosis, I mean, there's erosion on the maxillary interiors can be attributed to the dietary source, such as sucking on lemons or drinking wine or soft drinks. But the erosion on occlusal and palatal surface of maxillary molars without involving anterior teeth is most often secondary to regurgitation, gastro esophageal reflux, GERD, or nausea related to disease or medication. So, but the way you treat bulimia, which is binging and purging, is through sodium fluoride. You have to give them a lot of fluoride. You have to also establish regular eating patterns. But sodium fluoride rinses to aid with remineralization. Sodium bicarbonate rinse uh, can aid in neutralizing the vomit because it's very acidic, and we know that uh, baking soda is very basic, so it kind of adjusts the pH levels there in the mouth. And then also they should have uh, some psychological treatment as well. There has to be a team approach to this. And then pica is eating non-nutritive substances. So soil, paper, paint, coal. The causes are biochemical or iron or zinc deficiencies. Um, and treatment is psychosocial, environmental, and familial guidance. However, I've seen some patients with pica that seem like they might have a lot of other things going on. And then the last of it here, we're going to talk about the micro minerals, which are iron, copper, iodine, and zinc. Okay, we know that iron helps manufacture amino acids and hormones. Nutritional deficiency for iron is anemia, oral lesions, patchy tongue, brittle bones. So you get iron from meats, liver, dried beans, and nuts. Copper, it forms hemoglobin. A deficiency in copper can show as lesions with connective tissues and bones that result in failure to grow. Sources of copper are shellfish, oysters, crab, liver, and legumes. Iodine, we know that basal metabolic rate, we need iodine, and it also helps your thyroid gland. A deficiency in iodine is goiter. So we're going to see that, and we're going to talk about that when we get into pharmacology and other manifestations of thyroid diseases. But that iodine comes from salt as well. And then zinc, which is it helps with wound healing and immune function. And the highest concentration is found in bones. A deficiency in zinc is skin disorders, but the sources of zinc are also tofu, milk, and eggs. All right. And We're going to end this nutritional section with just the questions from the book here. So, uh, what is an alternative for glucose? Alternative name for glucose? We already know that's dextrose, right? Because glycogen is the carbohydrate storage form for glucose in humans and animals. We know that levulose is just another term for fructose, and maltose is a disaccharide. So those were the other options. That's just explaining why it's not those options. The next question, which two monosaccharides make up sucrose? Okay, so what's the term that we're going to remember for monosaccharides? We're going to go and remember, what is it? It is good for Gary, monosaccharides, right? Glucose, fructose, galactose. So the question is, which two monosaccharides make up sucrose? So what is sucrose? Sucrose is a disaccharide, which is, like we said before, sweet like me. Sucrose, lactose, maltose. So what two monosaccharides make up sucrose? And we're going to think of go floss because that's glucose and fructose. That's the answer. All right. So glucose and fructose make up the monosaccharide, the disaccharide sucrose. Some notes for this question is that lactose is hydrolyzed into glucose and galactose, which we talked about that earlier. And maltose is hydrolyzed into 2-glucose. And then fructose, 2 fructose molecules is not even a possible answer. So that's great to just come back to. So good for Gary for mono, sweet like me for di, polysaccharides are good for Steve. Again, good for Gary, glucose, fructose, galactose. Sweet like me, sucrose, lactose, maltose. Polysaccharides are good for Steve, glycogen, fibers, and starches. Most importantly, the disaccharides. Sucrose, go floss. Lactose, go Gary. Maltose, go glucose. And that tells you right there, there's 2 glucoses in maltose. Very good. Moving on. Which vitamin possesses intrinsic and extrinsic properties? That's going to be cobalamin, which is, as we know, vitamin B12. Okay. And one of the notes here is we know that ascorbic acid is vitamin C. Folate is another water-soluble B9 that prevents pinna bifida. So folate B9 prevents pinna bifida. Niacin is water-soluble, also B3. And niacin B3 prevents pellagra. Okay. So what is pellagra? Pellagra is the 4Ds: dementia, diarrhea, dermatitis, death. Niacin deficiency, pellagra. Which foods are good examples of complete proteins? Okay, that's meat, eggs, and cheese, animal sources. Incomplete proteins are plant sources such as grains, fruits, and vegetables. Number 5, which individuals should avoid consuming aspartame? We know it's phenylketonuria patients. People with PKU cannot metabolize amino acid phenylalanine, which is used to make aspartame. Also, diabetics with high blood pressure and also with blood pressure and marasmus can consume aspartame. So diabetics, anybody else can consume aspartame unless they have PKU, phenylketonuria. Those were just other options. Which fatty acid maintains serum levels? That's monounsaturated fatty acids. We know polyunsaturated decrease serum levels. Saturated fatty acids increase serum levels. And the polyunsaturated have the omega-6s and omega-3s, which are the essential fatty acids. And just to touch on that again, omega-6 is leic, omega-3 is linic. Omega-6 is vegetable oils, omega-3 is fish and certain plant oils. And they also carry vitamins A, D, E, and K. Moving on to the next question here. Which food source is a retinol? Well, we know that is vitamin A. So fortified milk and animal sources like fish and liver contain vitamin A. Carotenoids are orange yellow fruits and vegetables such as carrots, pumpkins, and tomatoes. So vitamin A comes from fortified milk also, which can also come from the liver and animal sources like fish. All right, which vitamin can interfere with the function of vitamin K? We should know this. That's vitamin E. Tocopherol. Too much vitamin E interacts with blood coagulation and can also cause gingival bleeding, especially if the patient is taking aspirin. Which vitamin is essential for the absorption of calcium and phosphorus? We know that's calciferol, vitamin D. Also, vitamin D is 90% comes from sunlight, so get out there in the sun. Deficiency can cause rickets in children, osteomalacia, and colon cancer in adults. Which vitamin is not a component of the B complex? We know that's ascorbic acid. Okay. So even though it's water soluble. So again, folic acid, riboflavin, niacin, thiamine, cobalamin, these are all part of the B vitamins. B vitamin complexes are water soluble. Vitamin C is in that water soluble context. Which vitamin promotes synthesis of collagen? Easy, vitamin C. Which vitamin functions as an antioxidant? Vitamin E, tocopherol. We know vitamin A, retinol, prevents night blindness. Vitamin D, calciferol, helps absorb calcium and phosphorus. And vitamin K, it helps coagulate blood. Vitamin K has a weird name too called quinones, which we're not going to get into. Which vitamin helps prevent spina bifida? Folate, yes. Niacin prevents pellagra. Riboflavin prevents glossitis and cholosis. And thiamine prevents beriberi. We know thiamine is B1. Which vitamin is essential in maintaining eye health? Very easy. Vitamin A, retinol. And which condition results from a severe niacin deficiency? Pellagra. We talked about that before. And so pellagra is the 4Ds: diarrhea, dimension, dermatitis, and beriberi is a thiamine deficiency B1, which is a damage to the nervous system and the cardiovascular system. Okay, so that is nutrition for the dental hygiene board exam. Thank you.